Hello, I would like to continue on the topic of the acute osteomyelitis. Now, first of all, we'll know about what is osteomyelitis. Osteomyelitis, osteo means bone, and litis or itis means the defect or the inflammation, the bone inflammation. This condition known as the osteomyelitis. So, from this topic, we have to study the three topic, including in this osteomyelitis or the septic arthritis chapter. First one is the acute osteomyelitis, another one is the chronic osteomyelitis, and last one is the septic arthritis. So we have these three important topic that frequently asked in the exam. So I like to continue one by one to continue further. So first one is the acute osteomyelitis. Now it is the inflammation of the bone and the medullary cavity that infect the shaft or the metaphysis of the long bone. What is the metaphysis? No? So suppose this one is the bone. First layer is the epiphysis, and then middle layer is the metaphysis, and again there is the diaphysis. In similar way, so the epiphysis and metaphysis, then the metaphysis, it is the defect of the metaphysis region. So what is the definition? It is the inflammation of the bone and the medullary cavity that infect the metaphysis of the long bone. What are the example of long bone? Long bone is the femur, the humerus, tibia, femur, fibula, understood? Your radius, ulna, these all are the example of the long bone. Now what are the etiology? Now के कारण है त? What are the etiology? Now your etiology is your E. coli. 80% are the Staphylococcus aureus, then Streptococcus, Salmonella, E. coli, Proteus, Pseudomonas. These all are the etiology. Now what are the location for the spread? Why this metaphysis chosen this bacteria to infect the hair? So there are three reasons. First reason is there is the highly vascular reason, highly vascular and nutritious reason. So there the bacteria or the organism that infect in the metaphysis region. Second one is there is the few number of monocyte and the macrophage there, so that they cannot eat in this macrophage and monocyte, this organism, so they can freely live there. And last one is your hairpin loop arrangement, so that there is a more vascular layer and there is the nutritious. These all three layer, these are all three component that why the bacteria infect there. These all are the why the spread to the metaphysis region. So let's move another clinical feature. Now what are the clinical feature? Acute osteomyelitis patient, what present to your OPD, if you are a doctor, and how can you diagnose whether he is the acute osteomyelitis patient, whether this is the chronic osteomyelitis patient or the septic arthritis patient. So first clinical feature we have to know. Then patient complain of the pain, severe pain liye ahuncha, severe pain. Then your complaining of the swelling, tenderness, inability to move the joint, and refusal to feed. Okay, this is all about your failure to thrive. These all are the symptom. And what are the sign? How can you diagnose the sign? First you can palpate there is the tenderness, ill looking, toxic look, and is the child is the toxic look. Then after what we are saying, that there is the pseudo paralysis. You can also set pseudo paralysis, inability to move the limbs, same as you are presenting the symptom, also same that way. And another presentation is the toxic look, fever, dehydration. Yes, dehydration means there is the loss of the fluid. Dehydration, toxic look. Okay, now what are the pathogenesis? What are the pathogenesis come here? Firstly, that the bacteria infect there. Then there is the formation of the dead bone, that the bacteria growth. डेड बोन बनाउँछ हैन डेड बोन दिस कल द sequestrum and again the newly sheathed bone come there that called the involucrum and after involucrum there is the discharging of the sinus or the pus that from the cloaca and after that discharging from the pus again from the skin that called the what we are saying that the called the sinuses. Okay, now what are the investigation you have done to diagnose that case? Investigation, first one is the x-ray. You first your diagnosis or the investigation is your x-ray. You can suggest patient to do x-ray. In x-ray you there is the changes that's seen after the 24 hour, not within the 24 hour, and after the 48 hour there is the soft tissue lucency or the soft tissue shadow is seen there, and after the 7 to 10 days there is the periosteal reaction that the bone changes, periosteal reaction. Okay, then our next investigation is your bone scan that is done by the technetium 99 or the gallium 67 scan. Then after you can do CT scan, MRI, yes, CT scan, MRI, and then after your gold standard is the biopsy. You can take the FNAC or the biopsy of the sample and you can diagnose the case. This is all about your investigation. Then we have again move the laboratory investigation. In laboratory investigation what we are taking the blood. You can take the blood and you can see the WBC, ESR and the CRP. All three are increasing. All three are increasing. Now you have done investigation also. You are taking the history, clinical features, symptoms, sign and symptom. Investigation you have done. What are the organism you have suspect? You can do the lab diagnosis also. Now you have to give the treatment. Yes, once the report came, you will see the oh my god, this is the organism. Now what are the treatment you have need to given that to the patient? First treatment is your conservative treatment. Conservative treatment means this patient have pain, severe pain, so you can give the analgesic drug that to relieve the pain, analgesic दिने. त्यसपछि that patient come dehydration, then IV fluid for the hydration. Yes, all the fluid lost, then you can give the IV fluid. Okay, then your conservative treatment is finished. Then after the splintage, you can bandage a splintage to the patient on their affected part so that they can prevent the leg or the limb to move here and there and reduce the pain. And another second point what we are saying that the elevation of the leg to reduce the swelling. Yes, that patient also present the swelling, no, there is limb swelling, that you can take the limb upright position, you lift your leg so that the swelling get reduced. Okay, this is all about your splinting. Then third what we are giving that the antibiotic. Okay, antibiotic is the empirical therapy. Yes, overall this is the main therapy, empirical therapy. And then after what we are saying is that another one is your, yes, according to the culture report, according to your investigation what we are given the patient to do the investigation. Once the report came, you can change the antibiotic also. Okay, you can change the antibiotic also. And last one is the what type of the drug you suggest, that is the flucloxacillin plus third generation cephalosporin. Understood? Cephalosporin, that is the cefozim. And then after the antibiotic we see the drainage also, you know? If there is a treatment, you know, within 24 hours no any drainage system can be applied. This is not necessary. After the seeing the 36 hour, no, after the 36 hour, if there is the abscess formation, there may be the swelling, edema, and there is the swelling, edema and the pus formation, fluctuation, then you need for the drainage. You need to go for the drainage. Okay, drainage is necessary. And our last that is the rehabilitation. What we are doing in rehabilitation, after this all the movement or the swelling subside and you can move your limb, you can able to move slowly you can move so that you can able to walk again. Then after the what are these differential diagnosis? How can you find this is the yes osteomyelitis? You can suspect also other disease. So other disease like your suspected is the septic arthritis. First is the septic arthritis. Then after the acute rheumatic fever, sickle cell crisis, no, your cellulitis, and then after last one is your gangrene, that is the streptococcal gangrene. And this again our last topic for this acute osteomyelitis is the complication. What are the complication that the patient present to you, that if we are not treated in time, then this patient suffer from the acute osteomyelitis to the chronic osteomyelitis. Again the septic arthritis, no, again the septic arthritis. Then after the alteration of the bone growth, there is the deformity and the damage of the epiphyseal plate. This is the local treatment, local complication, and the systemic complication is the septicemia and the metaphyseal abscess formation. This is all about the acute osteomyelitis, guys.